Hey, I'm Charles Loretto with NDP, your dental transition advisor. Today's topic, what to expect in a dental valuation. 3 key components. Number 1, cash. Cash is king. Number 2, the physical assets of the practice. Are they old or are they new? Lastly, it's location. Always talking about location, location, location. So those 3 are key pieces. But just to show you the variances in valuations in dental practices. Number 1, orthodontic practice in San Diego does $1 million as a 50% overhead. This valuation is going to come in right at 100% of collections, meaning the $1 million practice that collects $1 million is going to sell for about $1 million. Second extreme, a pediatric practice in rural America, Medicaid, and it's got older dental equipment, it may sell for only $400,000. Major variances between those 2 specialties. Why? Demand. I talked about demand, location, and then I talked about the cash and the assets. Even though this Medicaid practice makes a lot of money, it's actually a low barrier of entry for a pediatric dentist to come in, be right across the street, and be a competitor and build that practice right up. So that's why the practice of the Medicaid practice for pedo is much lower. In general, what can you expect? Roughly the $1 million GP practice with roughly about a 60% overhead is going to value somewhere around the 70% range. Are there other factors? Absolutely. Go to the NDP website or give us a ring and we'll tell you exactly what 20 to 30 factors are when we actually do evaluation. What does evaluation look like? Well, first, it's a nice written report. It's here and it's hopefully done by a CPA or even better than that, a CVA. And it tells you ultimately the thing is worth $600,000, $700,000, $800,000. Most importantly is all this stuff right here. These are the financials that support the valuation of this document. So, high level, 70% of collections, sure it's out there. Could it be higher? Could it be lower? Absolutely. The key to this process is expectations. Expectations for you, the seller, expectations for you, the buyer. What we want to do is build a relationship with you. So before you sell, you know what you're going to get, or before you buy, you know what you're going to get.